Welcome back to another episode of What Did the Patient Say with Doctors Dana and Lauren Brindisi, sisters and owners of Carolina Functional Neurology Center. We are bringing you inside information from real conversations we have with patients on a daily basis. We get asked the same questions and want to spread the truth on health and healing because we believe everyone deserves to know the answers.
Hi, everyone. Welcome back to another episode of What Did the Patient Say with me, Dr. Lauren Brindisi. And today I have a special guest, one of our newest members of the CFNC team. We have Dr. Deanna Tyler. She is here today. We're going to be talking a bit about neurodevelopment. Dr. Tyler, why don't you tell us just a little bit, give us a brief intro and let people know a little bit about you.
Yeah, absolutely. Nice to be here on the podcast, just educating you guys as well. I have an interesting background. I actually grew up in Eastern Europe and I transitioned to the US when I was a teenager. So through my experience, I struggled a lot in school and learning and education. And then I went on to also work with some individuals at the YMCA. So I actually have quite a bit of experience in working with children, and it just really showed me that there was an area of need, which is really trying to work with these children on really teaching them success in an educational background. And so when I delved into that and became a chiropractor and then a functional neurologist, I realized that there was a whole specialty with learning and behavior disorders, and basically brain rehab for children specifically in order to get through social milestones, educational milestones. And so it's been a passion of mine for quite a bit of some time now, and I'm excited to be working at CFNC and being able to treat some more kids here.
Yeah, this is really exciting because when you look at what we're doing at CFNC and what we're doing as functional neurologists as a whole, we talk a lot on our podcast, and a lot of what we see are patients with dysautonomias. But even with those, that range is wide, right? That might start around age 13 and go all the way up, through reproductive years is what we see. But as functional neurologists, we treat people across the neurological spectrum. So that starts with the little babies who might not be meeting their milestones, all the way up through neurodegenerative disorders that we see in our elderly population. And I think this is a really important conversation to have and for us to delve deeper into, because people need to understand that when it comes to neurological development, what happens when we're younger and how the brain develops, we have a really good understanding of what that actually looks like and some really important things that we can monitor. So Dr. Tyler, why don't you tell us a little bit about the basics there? What do people need to know when it comes to how our brain develops, and what are some of the things that as functional neurologists we're really looking out for?
Absolutely. There are obviously a lot of implications of things we should and should be doing when the children are in the womb, and that could be a whole new discussion as well. But when a child is born, what we're really looking for is, everyone knows about an APGAR score. Basically, it's an evaluation where they establish a baseline for that child, and essentially based on the time of birth, they can discuss how their development is going to progress within that first year. When you typically go to a pediatrician, as a parent or as a sibling, or even if you've just seen some videos, you've maybe seen some testing for what are called primitive reflexes. So primitive reflexes essentially are evaluations of these reflexogenic pathways that we have built in within our brainstem for survival purposes. So that stems from anything such as a rooting reflex, which allows for us to breastfeed, to being able to turn around and make sure that we are able to get some airway stimulation. So it really is just a basis of what we need in order to survive during that first year. And as our brain develops, as our frontal lobe develops, our postural reflexes develop, we are supposed to integrate those reflexes, and those reflexes are supposed to go away. But in a lot of instances, when we work with children with learning behavior disorders, or even when we work with people who've had a concussion or brain injury, we will often see this regression of these reflexes, or find out that they were never truly integrated in the first place.
Yeah, I thought that was so interesting when I first started learning about neurodevelopment, how the way that our brain grows and that we're pre-programmed with these motor patterns to help us survive, like Dr. Tyler said. And she mentioned the rooting reflex. We have the grasp reflex everybody talks about. They reach for a baby's hand and the baby grabs their hand. They think it's so cute. I had no idea that that really was a very, very important aspect of our neurodevelopment and something to be looking out for, because then I started asking myself all these questions. Well, what if a baby didn't have that grasp reflex? And in our training in neurology, as we delve deeper into that and we start talking about how crucial those motor patterns are, because movement is what grows our brain. So just like Dr. Tyler said, we start and it's mostly brainstem function and all of these things that are really automatic and pre-programmed. And then as we get an appropriate amount of stimulation, we start having our higher cortical regions come online. And that's where, she mentioned postural reflexes. So you start seeing, babies like sit up, they can hold their head up. And then that eventually transitions into more their ability to voluntarily move their body, which is at that point, right? We should have our frontal lobes come down and inhibit some of this information. What are some things that you see clinically, or what might be things for people to look out for if they think their kids aren't meeting these milestones? Maybe these primitive reflexes are a contributing factor. What do they do?
So typically, even just evaluating a child's behavior can be a really good indication. When we're looking at these primitive reflexes, we're also typically talking about the frontal lobe. Frontal lobe's primarily role is just to inhibit thoughts, inhibit impulses, inhibit actions. So when we don't have that control, things like hyperactivity are really common. When you look at coordination, we're looking at higher cortical regions like the cerebellum, frontal lobe, coordinates everything from how we move, how we run, are we coordinated, are we tripping, are we falling, to, something as simple as, are we good at hand-eye coordination sports? Can we even play a sport? Are we naturally kind of drawn away from that? Things like fidgeting. Fidgeting, most people would think of is typical child behavior, but can actually also occur from even a primitive reflex. So if we have a spinal galant reflex, which is a reflex that allows for us to exit the vaginal canal as we're born. Basically, if that reflex is not integrated from either being a cesarean birth or from other developmental milestones that haven't been met, then what typically will happen is children will have a hard time sitting still. They might get labeled as having a learning and behavior disorder when really they're just, every time something touches their back, they just naturally have that instinctive movement that occurs in the body. Things like wetting the bed. Wetting the bed at a certain age becomes abnormal. Sometimes people address from a psychological perspective, but it can also be involved with primitive reflexes. So it's really just looking at your child from a perspective of, are what they going through is typical to what their peers are going through? Are they developing appropriately through each year individually?
Yeah, and that's where we delve deeper into these developmental milestones and we talk about different movement patterns. And I feel like I hear this a lot. I have patients ask me this, um, what if my kid doesn't crawl? What if they just go to walking? Um, what do you think about that when it comes to some of these different milestones and how some people might meet them a little different? There's different ranges. What seems to stand out to you that might be some really important things for parents to look out for?
I think we all want to, I think people get excited when their children do skip milestones or progress really quickly. And so if a child doesn't really crawl much, I think most parents are typically very happy with that. They're saying, "Wow, my kid is so smart. He's already walking." And the reality is that those pathways need to be developed, and how they develop is by things like crawling. When we have that cross crawl pattern, we basically are just interconnecting both sides of our hemispheres, both sides of our big brain. And sometimes, if those areas haven't been integrated, what we would do when we basically retrain these primitive reflexes or reintegrate them, what we do is we go back to that first milestone where we try and replicate as much of that development that should have occurred in the first place. So sometimes that is involved things like bear crawls, right, which is literally crawling. Things like dead bugs, where we lay on our back and we do cross crawl movements. And so what we do is we basically try to reestablish that specific setting that they should have gone through if they skip that stage. And so when we're talking to parents, especially if we have a child here under the age of 10 and most of their history is reported by a parent, we will ask, did your child crawl? And most of them will say, I think they did. And, we typically just rely on a pediatrician just to tell us that those reflexes are integrated. But the reality is that often after the first year or two, those are never being tested again. And so, as a parent, that's something that you can do to make sure that your child is developing appropriately, is just to be aware of these reflexes and realize that these are really easily tested and give it a lot of information about the success of your child in the future.
Yeah, I think that's really important because, of course, we see patients again across this neurological spectrum. And a lot of times, even if they're still in adolescence and then they, maybe are developing some behavioral issues or having trouble in school and they're suspecting a learning disability or not super coordinated, but they do play sports and then they end up with a concussion,
Mhm.
is these are important aspects. These primitive reflexes are things that we look at as functional neurologists, even in our patients, no matter what age. This doesn't just hold true when it comes to pediatrics. There are a lot of people walking around that maybe never integrated these appropriately in the first place, or develop an injury, and now we start seeing some of these things come back out. What other areas would you look for? I know we talk a lot about neurology, but even, in some of our other podcasts, we touch on other systems and other really important contributing factors when it comes to someone developing, a neurological disorder or how we manage it. Anything else that, you've really studied or that stands out to you besides primitive reflexes of things that are important to keep an eye on?
I would say, primarily it's just whether or not the child is just kind of succeeding and thriving, right? So that comes even from like a social perspective, a social setting. So, in our field, we take a look at the eyes quite a bit. And that's because the eyes tell us a lot about what's going on within the brainstem. And so when you look at certain learning and behavior disorders, when you look at children on the spectrum, for instance, you'll see that things like eye contact aren't really present, right? Keeping your eyes still is a simple indication that really something within that brainstem might also be involved. So it's really reading the child just kind of from an outside perspective and just realizing, is the child basically performing socially and academically at the level that they should be at? And then how can we get them closer to some of those goals that they have?
Yeah, I think that's great. And that really, can take a team. And I love when parents come in and they just talk about all the things they've been doing for their child, really trying to be proactive about it because movement grows the brain. And the more we perform a task and we do it perfectly and we reintegrate this information, I mean, this is neuroplasticity. And some people maybe do need a little more assistance in that. And again, I think that's where we shine as functional neurologists, to come in and not sit and wait till somebody fits into a diagnostic box, right? A lot of these children don't get diagnosed right away, but it doesn't mean that there isn't something that can be done to help push their development in the right direction if maybe they're hitting a roadblock for one reason or another. There's a whole multitude of factors that could be contributing to somebody developing a neurodevelopmental disorder, a learning disability, or not having these primitive reflexes integrated appropriately. I mean, you just mentioned just the birthing process in itself, and there's probably a lot we don't know and understand when it comes to being in the womb. So these things are important because we understand these milestones, and just catching these little details are really interesting. I think really interesting part of our job, because we're just looking at it from a different perspective than just saying, do you fit in this diagnostic box or not? But how about just picking up on some of these social cues and, are, like you just said, Dr. Tyler, are they really meeting those criteria that we would expect? And it doesn't necessarily mean you should just, if something doesn't seem right, you don't want to fluff it off. But it may be something that's relatively simple to work on to just help push their development in the right direction. I think another really important piece that we do talk a lot about in our patients, and I think it's just a really important topic across the board these days, is what's going on with our gut microbiome and how is that affecting us, everybody as humans, but how is that really important when we're talking about neurodevelopment and how that's affecting our behavior?
Absolutely. And there's actually quite a bit of research supporting that as well. So, you know, associations with dysbiosis, which is where that improper gut bacteria ratio is occurring, that's been linked with all sorts of learning behavior disorders, anything from autism spectrum disorder to ADHD. And so our microbiome definitely is a feedback loop. And it really tells us about just the internal state, the inflammation within our body, and our bacteria, I mean, they have almost more DNA than we have in our body, right? So if we are looking at children development from a kind of a physical perspective, that definitely involves a lot of movement, involves being active. But when it comes to dietary changes and things like that, they're definitely just as essential, if not even more important in those first couple of years after birth. But what I wanted to mention was when you look at, when you're also evaluating children and we're looking at those small details, something that someone may not think of is, is my child ambidextrous? Are they able to use both of their hands? For some individuals, that may not seem pathological. If anything, it's a really cool party trick. I can write with both my right and my left hand, but what we start looking at with that is, are they using the dominant side of their body? Like if I asked you to, to look through a microscope and you could only use one eye, like which eye would you be using? If I ask you to hold a utensil, which hand would you be using and how would your hand be placed on the utensil? Are we holding the utensil like this where we don't have fine motor control? Because something as simple as having these imbalances, just tell us about the way that your brain is wired and how there is just asymmetry, because we typically do have a dominant side. And so with a lot of children with learning behavior disorders, we'll find that they may have an opposite presentation in their dominance, whether it comes from their visual input or their extremities, and we will notice that as well.
Yeah, I think that's an important piece when it comes to just observing people's behavior. There's just so much detail as we learn more and we study, clinical neuroscience. I find that so fascinating that all these little nuances that people do, just like you said, that's a great example of how people hold, their spoon, or do they write with one hand or the other. I always find it interesting because I'm left-handed
Mm,
and we live in a predominantly right-handed world. And very rarely do I meet people. And I think it's changing because, there were some, social and religious aspects to people kind of forcing their children to write with their right hand. But most people I meet that are left-handed don't solely do things left-handed. And this is more of just extrapolating some interesting information, but I always wonder, like, what does that mean for them? Because as being left-handed, I basically do everything left-handed, but there are a few things that I do right-handed just because the mouse was always on the right side. My brother taught me to play pool and he taught me right-handed. um, I wonder what that means when it comes to dominance, like we talk about, especially with language and those types of expression. Our brain wants to compartmentalize those things, and you don't really want to use both sides of your brain to do that because it wants to essentially conserve energy. And so it starts to compartmentalize that information. The
exactly. And that's changing those brain maps, right? So, I mean, everything that we do, even if you were to, use your left hand, if I'm right-handed and I'm using my left hand for, 2 weeks, I mean, I'm changing my cortical maps. So, those patterns are definitely creating long-term plasticity for those children. And like you mentioned, sometimes if someone is left-handed or they just tend to have a tendency to kind of use their environment as cues of what extremity they should be using, that doesn't always mean that it's pathology. It's just like any other sign. If we see one positive finding for somebody, that doesn't tell us what's going on. That just tells us that we need to look further. And so when we're evaluating children, it's really just looking at all the pieces together, where we really are able to decide, what does this child need, or even early, young adult. So a lot of times, like she was mentioning, we don't really necessarily have to be working with children to be looking at these primitive reflexes. So if I have an adult in 22 years old, I'm still probably going to check primitive reflexes, especially if I'm seeing patterns that indicate that it might be a contributing factor or never really was truly addressed. And that will typically come out in the history.
That's great. I think there's so much more that we could really delve into. I love just setting up and talking about the basics, and we can really start to delve deeper into some of these truly pathological situations that people do fall into. I think it's important to talk about the overlaps and the gray areas. What are some common neurodevelopmental conditions that you see in practice and that you have experience with?
So primarily my experience has been with ADHD, as well as ADD, so attention deficit disorder, and hyperactivity disorder, and then also quite a bit of dyslexia. So when you look at those conditions, our primary focus, even just from the condition alone, there's quite a bit of research supporting which areas of the brain we should focus on. When it comes to our ADHD kiddos, really looking primarily at specific regions of the frontal lobe. When we're looking at more of the dyslexia, we're looking at that parietal region, more of just kind of cortical mapping, right? And we even have a specific side that we would focus on. Again, every child's brain is a little bit different, so we do evaluate it individually. But those are the conditions that I primarily have had the pleasure working with. And what's really cool about that is when we have children with learning behavior disorders, if they're able to overcome some of those struggles, they tend to be some of the hardest working individuals out there and probably most successful. And I think that's because we do sometimes have to struggle a little bit to really get that work ethic to be up high enough, and to also kind of get past something and just realize that if we can overcome something like dyslexia and still succeed in life, we typically are going to be able to use that as kind of momentum later on in life. So I actually had a friend in school, chiropractic school, who went to special school for dyslexia, and then he became a chiropractor and a doctor, and now his passion is also working with children. So everything kind of works around in full circle.
Yeah, I love that. I think we should definitely do another one of these and talk a little bit deeper into some of these conditions and what we're seeing in practice. And as these kids grow, it's very interesting. It's very inspiring when you get to watch a kid and their behavior change, and you can just see them and their personality come out. They're not so much a victim to whatever they're dealing with, and they really truly get to be themselves. And it's really exciting and really inspiring, especially in these really complicated conditions that you know no one knows they're going to fall into that situation in which their kid may need that extra help. And there's lots of help out there, so make sure if you guys have any questions or comments, um, anything, comment, DM us, let us know. We're here to help. People deserve to know this information, and need to know that functional neurology is out there and is an avenue, but not the only avenue. So there's tons of providers out there that work with children in these categories, and it may not be a one size fits all, and it usually takes a team. So if you guys have anything else you want us to talk about in this category, please let us know. We will be starting to open up this avenue. This is the first time we're really delving into neurodevelopmental disorders, and we want to make sure that we're discussing things that interest you guys. So thank you, Dr. Tyler, for coming on with us. We're really excited to have you on the CFNC team, and I'm looking forward to talking to you again soon.
Sounds good. Thank you.
Bye.
Bye.